You wake up, stretch, grab your morning coffee. Then your fingers suddenly go slack. The mug shatters on the floor. Maybe it doesn't happen with a coffee mug. Maybe it's a burning sensation creeping into your hand after an hour of typing, or your fingers going numb while holding the steering wheel on your commute. You might just find yourself dropping your keys more often than usual. It's easy to brush these moments off. You shake out your hands and assume your muscles are tired, or your joints are acting up from a long week. That tingling signals a specific mechanical issue known as carpal tunnel syndrome. This is one of the most common nerve-related conditions affecting the hand and wrist today. Waiting for that tingling to simply fade away is a mistake. What you are experiencing is an active mechanical failure happening inside your wrist. If left undiagnosed, it can lead to long-term weakness. To understand why this happens, look at this space right in the center of your wrist diagram. This is the carpal tunnel. It is a highly narrow, rigid physical passageway. The floor and walls are made of solid bone, and the roof is a thick, inflexible band of tissue called a ligament. Inside this tight space, it gets crowded fast. You have several tendons running through here, which act like cables pulling your fingers to make them move. Sitting right alongside them is the median nerve, a highly sensitive electrical cable that gives your hand its sense of touch. When you use your hands for repetitive, rapid tasks, like typing on a keyboard, sewing, or working manual labor, those tendons are constantly sliding back and forth. All that friction causes the tendons to become irritated and swell slightly. Mechanical friction is not the only trigger. Underlying health conditions can also introduce swelling from the inside out. Diabetes, thyroid disorders, rheumatoid arthritis, obesity, and even pregnancy can all cause fluid retention and inflammation throughout the body. Because the bones and ligaments forming the tunnel cannot expand, all that extra swelling has nowhere to go. The space fills up, and the softest thing inside, that highly sensitive median nerve, gets violently crushed against the unyielding walls. This failure is a matter of spatial physics. When the pressure inside that rigid tube spikes, it suffocates the nerve, regardless of the actual strength of your hand muscles. This topographical diagram shows exactly where that nerve travels. When the median nerve is crushed at the wrist, its electrical signals misfire. Because of how the nerve branches out, you will feel tingling, burning, or numbness isolated to very specific areas: your thumb, index, middle, and exactly half of your ring finger. This compression actually gets worse when your hands are inactive. Fluid pools in your wrist while you rest, leading to intense pain that tends to peak at night and frequently disturbs sleep. As the physical crushing continues, you start to lose function. A blocked nerve signal means your brain cannot properly communicate with your hand muscles, resulting in grip strength so weak that you struggle to hold everyday objects securely. To find exactly where the breakdown is happening, specialists run detailed clinical examinations. They test specific muscle strengths and perform physical wrist maneuvers to see if they can replicate the pressure on the nerve. When symptoms are advanced, doctors use nerve conduction studies, or NCV, to measure the exact severity of the electrical blockage. Take a look at these two graphs. The top shows the fast, sharp electrical wave of a healthy nerve. The bottom shows a delayed, flattened wave. That flat line confirms the signal is physically blocked. Restoring a functional hand depends on repairing this corrupted electrical signal. Simply resting the hand won't fix the underlying blockage. The good news is that if you catch this compression early, severe surgery is rarely needed. Proper rehabilitation-based recovery is highly effective at relieving the pressure. This diagram shows the first line of defense. By combining medication to drop the internal inflammation with a physical brace, you change the physical space. Wearing a rigid wrist splint, especially at night, prevents your wrist from bending while you sleep, helping forcefully keep the tunnel open. Once the space is propped open, active physiotherapy steps in. Specialists use targeted nerve and tendon gliding exercises. These specific movements train the compressed nerve and the surrounding tendons to glide smoothly again, preventing them from catching in the narrow space. If the condition persists, doctors can use localized injection therapy. Surgery is kept strictly in reserve for severe or long-standing cases where the nerve damage is advanced. You can actively prevent that space from narrowing in the first place. Maintain proper wrist ergonomics at your desk. Avoid gripping tools for prolonged periods. Take frequent breaks during computer work and stretch regularly. It is equally vital to manage any underlying medical conditions, like diabetes or thyroid issues, to stop systemic swelling before it starts. At Ananta Health in Vadodara, led by Dr. Nirav Joshi, the focus is exactly this type of comprehensive care. The philosophy centers on accurate diagnosis, ergonomic guidance, and non-surgical recovery to effectively treat nerve, muscle, and joint conditions. Do not wait for a temporary tingle to turn into permanent nerve damage. If night pain disrupts your sleep, or you notice your grip getting weaker, pick up the phone and consult a rehabilitation specialist today.